8 billion people are one plane ride away from having a child who's a U.S. citizen.
Well, it's a new world. It's the same Constitution.
One plane ride.
The sigh. So on April 1st, 2026, and no, that is not an April Fool's joke, the Supreme Court of the United States heard arguments in a case that would rewrite what it means to be born in America. Not for immigrants, not for visa holders, but for the babies born here on U.S. soil in American hospitals. And for the first time in history, a sitting president showed up to the Supreme Court to watch. Donald Trump sat inside that courtroom watching 9 justices decide whether his signature can erase the birthright of American-born children. And the question before the court's simple. Born here, does that still mean citizen? The answer has been the same for 157 years. Yes, the administration says that answer is wrong. And we are here, Dr. Sloan and I, as physicians, to tell you what happens to babies if Trump gets his way. I'm Dr. Haydée Brown.
And I'm Dr. Sonya Sloan.
And we are AYA.
Black and Brown Women Disruptors in Healthcare and Beyond. So today we're going inside the courtroom because what was argued before those justices this week is not just a constitutional debate. It's actually a public health emergency that we're watching unfold in slow motion.
You know, when you change who gets to be born a citizen in this country, you change who gets a birth certificate, who gets Medicaid, who gets a pediatrician. This is who survives their first year of life.
And someone is going to try to tell you that this is about what? Saving money. But we got receipts today, you guys, and we're going to go through all of this, every single one, and tell you. So let's start at the base, the foundation, why the law even exists, because it does matter. So the 14th Amendment, ratified in 1868, 3 years after the Civil War, says, a person born or naturalized in the United States and subject to the jurisdiction thereof are citizens of the United States. So the amendment was not written by accident, Dr. Brown. It was written to what? Overturn the Dred Scott decision, the 1857 ruling that said black people, whether enslaved or free, could never be citizens. So let's think about that. The birthright citizenship was born as a direct correction to racism. They were trying to fix it. So the law saying we will not sort human beings at their birth by the circumstances of their parents.
And in 1898, 30 years later, the Supreme Court affirmed in the United States versus Wong Kim Ark that birthright citizenship applied to the children of Chinese immigrants, parents who were legally barred from ever becoming citizens themselves. The court said it doesn't matter. Born here, citizen here. That precedent has held for 127 years.
And who has it been protecting all this time? The children of immigrants, you guys. The children of workers were brought here by force and desperation, maybe. The children of people this country needed for labor because they refused to let us in, though, to the civic life.
So does that sound familiar? Because on January 20th, 2025, day one, Trump signed Executive Order 14160, attempting to end birthright citizenship for children born to undocumented parents. So that's not by amending the Constitution, not through Congress, by executive order with a pen. Every federal court that heard it blocked it immediately. And this week it reached the Supreme Court in a case called Trump versus Barbara.
So now your president, Trump, tried to frame this as narrow, as targeted, as small, just a little adjustment in the immigration policy, right? But when his own Solicitor General was pressed on the scale, the answer revealed everything. Let's roll this clip.
Suggesting that when a baby is born, people have to have documents, present documents. Is this happening in the delivery room? How are we determining when or whether a newborn child is a citizen of the United States under your rule?
And I think that's directly addressed in the SSA guidance that's cited in our brief. What SSA says is there's currently a system where, for example, Social Security numbers are generated based on the birth certificate. They say this can still be, for the vast majority of instances, completely transparent. You will still get
No, not transparent. I'm just talking about the particulars, because now you say your rule turns on whether the person intended to stay in the United States.
So that's Justice Jackson and Solicitor General Sauer. So the question is, what's here unlawfully? That is the threshold this administration wants to attach to a newborn. But here's what the numbers actually say. This order doesn't just affect children of undocumented immigrants. It reaches children born to international students, H-1B workers. Those are your engineers and doctors and researchers that this country recruits. Your asylum seekers, your DACA recipients, so people with pending green cards whose paperwork isn't finalized yet. Estimates from legal experts put the number of families potentially affected between 5.5 and 6.5 million. And then going forward, 200,000 babies are born every year to immigrant parents in the country. So under this order, each one of them begins life stateless. Not American, not a citizen of their parents' country by birth, stateless.
That is not hypothetical. That's a public health catastrophe dressed in what? Constitutional clothing. And even the justices saw it, because Chief Justice Roberts, not exactly a progressive, champion, told the Solicitor General that his arguments were a little quirky. And then Justice Kavanaugh said that if we were following precedents, this is a short opinion. So that got laughs in the courtroom, right? And then Justice Sotomayor asked directly, so does this administration plan to unnaturalize people who already have citizenship?
The bench was skeptical across ideological lines, but skeptical is just not decided, right? Until that ruling comes, expected at the end of June or early July, the chilling effect on pregnant families is already here today.
And that's real. And let's really get real. Real in a way that only happens when a brilliant Black woman in a position of power refuses to let legal theory outrun human consequences. So my favorite, Justice Ketanji Brown Jackson, pressed the Solicitor General on the mechanics of the order, not the philosophy, the mechanics. Because, Dr. Brown and I, physicians, specifically orthopedic surgeons, we want to know the mechanics of everything, how it works. So, when you're in the delivery room, right, Dr. Brown, that's not when you do paperwork. It's not a paperwork moment. This is when medical emergencies and every second really does matter.
So we have the Solicitor General telling the Supreme Court of the United States that determining a newborn's citizenship status in real time in the delivery room is based on the immigration status of both parents, and that is completely transparent as a process. I mean, let me tell you what's actually happening in the delivery room. We have a laboring mother, possibly in distress. You have fetal monitoring, you've got hemorrhage risk, you've got oxygen saturation, an emergency C-section may be underway, and we're saying this is the delivery room. It could be the emergency room. It could be anywhere, right? There is no moment, not a single moment in that clinical environment where anyone should pause to assess immigration documentation. What are you going to say? Push, wait, hold on, let me see your green card?
No, like that. And any woman that's pregnant probably is going to jump off that table and, nonetheless. So Justice Jackson also asked, are we bringing pregnant women in for depositions now? And the ACLU staff attorney, after the argument, said plainly, are you now asking women to bring in their identification to hospitals? And after 10% of birth certificates list that the father is unknown usually. And what happens to those babies under this order, if that's even a question, right? Let's roll this clip.
I think Justice Barrett brought this up. So are we bringing pregnant women in for depositions? What are we doing to figure this out?
No, as I pointed out earlier, the executive order turns on lawfulness of status. So if you give birth to a baby in the hospital right now, it gets the birth certificate in the system. There's a computer system.
So there's apparently no opportunity then for the person to prove or to say that they actually intended to stay in the United States.
Absolutely not. The opposite is true. Their opportunity to dispute if they think they were wrongly denied, which would only happen in a tiny minority of cases, is directly addressed in that guidance.
After the fact,
yes.
after their baby has been denied citizenship, then we can go through the process.
Yes.
So after the baby is denied, so in the gap between birth and process, that child has no birth certificate confirming that they're a citizen, right? No automatic eligibility to Medicaid, no social security number, no WIC, no chip, no identity that connects them to what every safety net that is built in for newborns in the United States.
And Trump left before the arguments ended, right? He walked out of that courtroom and posted on Truth Social, of course, quote, "We are the only country in the world stupid enough to allow birthright citizenship," end quote. The President of the United States calling the 14th Amendment stupid about babies.
Yeah, here we go. So let's put on my reading glasses. I'm about to fall out here because someone, and you guys know who it is, you guys know every time, he's going to say this is about what? Fiscal responsibility. And that we simply cannot afford to provide healthcare to children of undocumented immigrants. But I mean, we had some receipts last week talking about how much money they spent around the world and never paid TSA workers. And do we have receipts about this, Dr. Brown?
Oh, yes, Dr. Sloan. We have the receipts. So EMTALA, on the book since 1986, requires hospitals to treat anyone in an emergency, regardless of immigration status, regardless of any executive order, because they are human beings, right? That's the reason. And that law is not changing. So what does emergency Medicaid for undocumented immigrants actually cost? So according to the Kaiser Family Foundation, it's $3.8 billion. That was in 2023. And that sounds enormous, right? Until you learn that total Medicaid spending that year was $970 billion. So the emergency Medicaid is 0.4%. Okay, 0.4%.
And the study in JAMA calculated that to be per resident. So that was $9.63 per person per year, not per month, per year. That's less than 2 cups of coffee, for emergency medical care, including a safe childhood. The entire population of people who pick crops, build homes, staff our hospitals, and raise our children, $9.63 a year.
A year. And then in states with the highest undocumented populations, California, Texas, New York, Florida, emergency Medicaid accounts for, you ready? Just 0.9% of the state's Medicaid spending. So not even 1%. And that's in the highest impact states. So researchers from Emory, Colorado, and Harvard published this analysis together and said plainly, cutting emergency Medicaid will, quote, save little and harm states with large undocumented populations, end quote.
End quote. But here's the cruel math that, we want everyone to see, but you need to understand. Over 80% of emergency Medicaid spending is on what? Labor and delivery and childbirth. So when people say cutting emergency Medicaid, what they're actually saying is we're going to stop paying for babies to be born safely.
And here's the part that should make every taxpayer furious, regardless of where you stand on immigration. If you eliminate emergency Medicaid coverage, you don't eliminate the emergency, you eliminate the coverage. EMTALA still requires hospitals to treat patients in crisis. So the bill doesn't disappear. It becomes uncompensated care. And so which hospitals then pass to private insurers, right? So it's passed directly to you in the form of higher premiums.
That's not fiscal responsibility. That's fiscal theater, and it shifts the bill. It does not eliminate one, right? It simultaneously drives pregnant women away from prenatal care, leading to higher birth risk, NICU admissions, and more maternal deaths, and preventable tragedies that cost the system far more than $9.63 a year that we're already spending anyway.
This was never about saving money. It was always about who we decide deserves to be saved.
And I want to go way back in history just for a moment because, we talked about it earlier. So let's say it a little bit louder that in the 14th Amendment, which was written for Black people specifically, it was a legal correction after Dred Scott and the promise that birth on American soil could never again be used to destroy personhood.
So the communities that would bear the heaviest health consequences of this order, right, the uninsured newborns, the missed vaccinations, the mothers avoiding the hospitals, are the same communities that are already navigating the worst maternal and infant health outcomes in the country. Black families, brown families, immigrant families, Latino families, poor families, right? This is not incidental. This is structural. It is by design.
Yeah. And so when you strip away citizenship from a newborn before they even leave the hospital, you're not changing their legal status. You're making them administratively invisible. That's major, you guys. So no birth certificate with citizenship is confirmed. No social security number is issued, or no Medicaid file is ever open. No census record. No school enrollment pathway. No official presence in the system that allocates resources and funding, or political power. And that's what it's all about, right?
Right. All with a pin, right? Signing. Autocracy, right? Autocracy, it just doesn't fear immigrants. It fears the political futures of their children. No data, no crisis. We've said it before. We'll say it again. If you can't count a child, you can't prove their suffering. If you can't prove your suffering, you can't demand more resources. If you can't demand resources, those children stay invisible. And invisible people don't vote. Invisible people don't organize. Invisible people don't accumulate political power. So the cruelest part, these children had no say in where they were born, who their parents are, or what legal status their family carries. They were born on this soil, and someone decided that wasn't enough.
So the Supreme Court's decision that's expected in June or early July, but the chilling effects are already here. The fact that we're talking about this, and pregnant women and mixed families are already skipping appointments because of fear, right? Already avoiding the system that exists to keep them and their babies alive. And here we are. And what do we need right now? If you're a pregnant woman, listen to us. We want you, if you're pregnant or you know someone that's pregnant, go to the perinatal appointments. Your baby's health cannot wait for this ruling. And if you're a mixed family status, connect with a health community worker that can possibly give you some information, provide some care, a legal aid clinic, a hospital patient advocate who can walk you through this process then when we're all confused right now.
And know this, until the Supreme Court rules otherwise, every baby born on U.S. soil is still a U.S. citizen. That has not changed. So when someone tries to tell you that this whole thing is about saving money, you tell them it costs $9.63 per American per year to provide emergency health care, including safe childbirth, to undocumented immigrants in this country. $9.63. That's less than 2 cups of coffee for a human life brought safely into this world.
So if that's the price that we're debating, then this was never about budget. Come on. It's really more about just who belongs, not money. And we know that happens all the time with this government when they decide which babies are worth counting.
We have lived that history. We carry it in our bodies, and we are not going back.
So stay informed, stay vigilant, and stay loud. We're AYA, contributors to MeidasTouch Network, and proud members of the Meidas Mighty. Please subscribe, like, share, and follow for more. Have a great week.
Have a great week, everyone.
Want to stay plugged in? Become a subscriber to our Substack at MeidasPlus.com. You'll get daily recaps from Ron Filipkowski, ad-free episodes of our podcast, and more exclusive content only available at MeidasPlus.com.